Hello, my name is Mike Holt. I'm CEO of ConnectedHealth. We connect caregivers, patients, and suppliers wirelessly. We do that by enabling the transfer of data from devices like scales, blood pressure monitors, glucose meters, through our health gateway to patient records accessible over the internet. So that's shown here: scale, glucose meter, blood pressure monitor. We use an Android phone as the health gateway. Data is transferred through the phone to healthcare records or our portal that caregivers can then monitor remotely over the internet. So we're going to do a demo today. We've got these various devices that we work with. We have a scale, Bluetooth scale, blood pressure monitor, pulse oximeter, and this is a glucose meter. And then finally, an Android phone, which is configured to be the health gateway for ConnectedHealth. So Charlie's going to come and give us a demo, and Charlie is our lead engineer. So first, Charlie, let's demo the pulse oximeter.
Right, so this is the pulse oximeter, Bluetooth pulse oximeter. I'm going to insert my finger to this, and it's taking my reading now.
So Charlie's doing what he normally does. Nothing different. Puts on the pulse oximeter, and then the data is being measured, and his pulse is transferred through the health gateway to our server. I also get an SMS as a caregiver notifying me of the reading. I can set an alarm or a level or an alert that notifies me if I need to take action based on the reading. So that's a pulse oximeter. Let's try the blood pressure monitor.
Right.
So again, Charlie is doing what he normally does. He doesn't do anything special, simply takes his blood pressure reading the way he always does. So the device is measuring his blood pressure, and then it's going to transfer the results without Charlie doing anything through our health gateway to the ConnectedHealth server. Okay, so the measurement's been taken, and the data is transferred through our health gateway to the server. And as a caregiver, again, I get an SMS notifying me that the blood pressure has been taken. We could have set an alert that tells me that his blood pressure is too high and he needs to come in for observation or whatever. So also, we've got a scale. So Charlie will measure his weight the way he normally does. Simply stand on the scale. So his weight's been measured, and then the data is transferred via our health gateway to the server. And again, an SMS alert, if I choose to get one as a caregiver, notifying me of the weight or action to take. And finally, we've got a glucose meter. And Charlie will take his glucose reading the way he normally does. And the result is transferred automatically through our health gateway. And so no longer do diabetic patients need to record all their measurements for their doctors to review. Instead, it happens automatically. So the measurements taken, transferred, stored on the server so that me as a caregiver can access the information. This is all secure, so it's private and secure. And likewise, I get an SMS either notifying me of the result or possibly notifying me if Charlie fails to take his measurements. And so I know that I need to follow up with him. Thanks, Charlie.